Most of the depictions on the media are not what therapy is like. We wanted to create a documentary that captures what therapy is really like. The slowness of it, the authenticity of it, the delicacy of it. That was really appealing to me. Who's gonna tell me what's happening? The most common theme that I've pulled as a thread working with lots of couples is how difficult it is to come to terms with the otherness of their partner. With the fact that we're all different. When they're confronted with their partner's otherness, people's first reaction is to try to figure out who's right, who's wrong, who's good, who's bad. We often hear feedback from viewers that they start off having deep identification or empathy for one of the characters and dislike for the other. And over time, by getting to know each of the people on the show, they come to feel for them. It's learning something about our humanity. You'll find that we're all more alike than we think.
Orna, why do you do this to me, girl?
It's not easy to find a therapist, especially nowadays, because therapists are really booked up. There are certain areas of the country where it's hard to find a therapist, period, just because there are not many of them. If you know people that are in therapy, ask them to ask their therapist for referrals. That's the best way. Psychology Today has like a website full of therapists that describe little blurbs about themselves that is actually a very good tool. Psychoanalytic training institutes often have clinics that offer reduced fee therapy and offer the therapist supervision. And that's often a really great way to get into therapy. It's more accessible, and the person is also under supervision, so they're getting a lot of attention. The work is getting a lot of attention. You don't have to totally prepare for a first session. Just come as you are, as honestly as you can, and assume that the person you're talking to is not there to judge you, but wants to actually help you with whatever you need. Don't waste your or your therapist's time not talking honestly about things. Really important self-care. There are areas of self-care that have to do with the actual practice. As a therapist, it's incredibly important to find ways to think through intense material that help you carry it. It's also important not to feel lonely in the work. When you hire a supervisor or when you create a peer supervision group, the group is confined to a very strict frame of confidentiality. You can talk with peers about what's going on. And that's also super important, to not be alone with sometimes very intense material. We help each other carry the weight of trauma that we sit with. What I think is super important for therapists, for analysts to do is also to do things that have nothing to do with the profession. I listen to a lot of music. I go and see art. I read fiction, poetry. I spend a lot of time with friends. My kids are like an amazing source of self-care for me. Relationships, just good relationships. I have a good practice of yoga. A lot of affect and meaning is stored in the body, and it's important to kind of have that circulate too and take care of that side of things. Okay, you're cured. No. I'm hoping that the show increases people's capacity for compassion, both for themselves and for other people. Hold multiple perspectives in mind, not just your own. That's our goal.